Hello everyone. Today we are going to learn about inflammation. What is inflammation? Inflammation is a local response by living mammalian tissues to an injury due to any agent. Inflammation is actually a defense mechanism. What defense mechanism against infectious agents or any injury? What it does is it neutralizes the infectious agent and allows the healing process to begin in our body wherever there is an injury or infection. So this is what is inflammation. The inflammation is defined as the local response of living mammalian tissues to injury due to any agent. So now let us know about the causes of inflammation. What are the causes of inflammation? The causes of inflammation can be any agent which led to the injury. Like they can be infective agents. The infective agents can be bacteria, viruses, fungi, parasites. The toxins of bacteria, viruses, they all are infective agents. Then we have immunological agents. Whenever there are cell-mediated reactions, whenever there are antigen-antibody reactions, they can also lead to injury and they can lead to inflammation. The other is physical agents. Physical agents like heat or cold, such things which are leading to injury are the physical agents. Then we have chemical agents. Chemical agents can be organic or inorganic poisons or acids or can be any of the chemicals. Then we have inert materials. Inert materials, they can be any foreign materials which is entering our body or which are leading to injury to in our body may lead to inflammation. So these are the causes of inflammation. Now we have to know the very important thing in inflammation is the signs of inflammation. The signs of inflammation. What are the 5 cardinal signs of inflammation? The first cardinal sign of inflammation is rubor. What is rubor? Rubor means redness. Okay, rubor means redness. Whenever there is inflammation, there is redness. Okay. Then we have tumor. What does tumor mean? Tumor, you have heard in my previous video, tumor is like growing something. It's actually not growing, it's a swelling. Tumor means swelling. So there will be rubor, redness, tumor, swelling. Then calor. Calor means heat. There will be heat. Whenever there is inflammation, there is heat. Then we have dolor. The patient may complain of pain. Wherever there is swelling, there will be pain. Means inflammation is it has pain. Okay. Then functionalism, loss of function. Whenever there is inflammation, the person may lose the function of the part in which he has inflammation. So these are the 5 cardinal signs: rubor, tumor, calor, dolor, functionalism. Okay, so now let us know about the types of inflammation. Depending upon the defense capacity of the host and the duration of response, the inflammation is of 2 types. These are acute inflammation and chronic inflammation. Okay, depending upon what? The defense capacity of host, first point, and the second point is the duration of response. Okay, let us know the difference between the acute inflammation and the chronic inflammation. The acute inflammation, the onset of acute inflammation is rapid and the onset of the chronic inflammation is slower. In acute inflammation, the prominent cellular infiltrates are neutrophil cells. But in case of chronic inflammation comes the monocytes, macrophages and the lymphocytes. Now the local and systemic signs are prominent in case of acute inflammation. What are the local and systemic signs? These are the Ruber, Dollar, Keller. These signs are prominent in case of acute inflammation, but they are not prominent in case of chronic inflammation. Now, the tissue injury and fibrosis is mild and it is self-limiting in case of acute inflammation, but in case of chronic inflammation it is severe. Now, the causative agents of the acute inflammation are like infections or physical agents of foreign bodies, etc. The chronic inflammation occurs due to recurrent acute inflammations or persistent acute infections or autoimmune reactions, and these are the reasons for chronic inflammation. Now let us know about the duration. The duration of acute infections can be up to few days, but in case of chronic infection the duration is up to many months or years. Okay, and the outcome of this acute inflammation is it can be resolved, either resolution, or there can be formation of abscess formation, or there can be chronic, it can convert into chronic inflammation. Then in case of chronic inflammation, what happens? The outcome can be tissue destruction or fibrosis. So this is all here about the difference between the acute inflammation and the chronic inflammation. I hope you understood the topic.